So I think if you look at the data in total for primary prevention of cardiovascular events, aspirin has not met its primary endpoint in an individual study, which meant it did not meet its endpoint that it was designed to for the purpose of reducing the first heart attack or stroke. However, when you put all the data together, so that's called a large meta-analysis, you can see that aspirin has a marginal benefit in decreasing heart attack or stroke. The problem is there's also some potential risk. So it's probably not as simple as stating every person above the age of X should be on aspirin, or every person with a diagnosis of hypertension should be on aspirin. That's why it's really important to have that conversation. I think if you understand an individual's risk and know what their risk is of a thrombotic event or a clotting event, such as a heart attack, understand that individual's risk of bleeding, then you can make a really smart decision whether or not that person should be on aspirin. But I think using it in the population for everyone, I think is a little bit too simplistic. So I think that there are populations out there, there are regions out there, there are countries where the prevention of cardiovascular disease is of paramount importance. I think that there may be a role at some point for the poly pill, a simple pill that has a lot of different ingredients that can prevent a heart attack or stroke. But I think we have to remind ourselves what the major issues are. Why is all of a sudden cardiovascular disease becoming a major epidemic in certain countries or certain areas? And I think we have to remind ourselves there's a lot about it regarding diet. There's a lot of things we can do regarding physical activity. I think medication has a role. I think it has an important role. But I think we have to remind ourselves how we got into this problem. And I think that aspirin, while it may be beneficial within this pill in certain regions, I do not think it is the first thing we should be targeting. I think we should have, a target towards helping people understand why they're at risk for having a heart attack, why they're at risk for having a stroke, and combat that. Education is extremely important. Getting people to understand that it's not only about a pill, it's about something they can do, I think would really have a tremendous benefit.